Multiple myeloma. A malignant proliferation of plasma cells within the bone. Excessive numbers of abnormal plasma cells invade the bone marrow and ultimately destroy bone. Invasion of the lymph nodes, spleen, and liver occurs. The abnormal plasma cells produce an abnormal antibody, myeloma protein or the Bence-Jones protein, found in the blood and urine. Multiple myeloma causes decreased production of immunoglobulin and antibodies and increased levels of uric acid and calcium, which can lead to kidney failure. Assessment. Skeletal pain, especially in the ribs, spine, and pelvis. Weakness and fatigue. Recurrent infections. The disease typically develops slowly, and the cause is unknown. Urinalysis shows Bence-Jones proteinuria and elevated total serum protein level. Anemia. Osteoporosis, bone loss and the development of pathological fractures. Thrombocytopenia and leukopenia. 8. Elevated calcium and uric acid levels. Kidney failure. Spinal cord compression and paraplegia. Bone marrow aspiration shows an abnormal number of immature plasma cells. Interventions. Administer chemotherapy as prescribed. Provide supportive care to control symptoms and prevent complications, especially bone fractures, hypercalcemia, kidney failure, and infections. Maintain neutropenic and bleeding precautions as necessary. Monitor for signs of bleeding, infection, and skeletal fractures. Encourage the consumption of at least 2 liters of fluids per day to offset potential problems associated with hypercalcemia, hyperuricemia, and proteinuria, and encourage additional fluid as indicated and tolerated. Monitor for signs of kidney failure. Collect 24-hour urine as prescribed. Encourage ambulation to prevent renal problems and to slow down bone resorption. Administer 4 fluids and diuretics as prescribed to increase renal excretion of calcium. Administer blood transfusions as prescribed for anemia. Administer analgesics as prescribed and provide non-pharmacological therapies to control pain. Instruct the client in home care measures and the signs and symptoms of infection. Administer bisphosphonate medications as prescribed to slow bone damage and reduce pain and risk of fractures. 11. Administer